And we're back.
Okay, so now that we've done your weight, we're going to check your hands, your radial pulse, and your blood pressure. So bring your hands. Okay. I'm probably going to do this with each body part. Okay. And I'm just going to take your radial pulse.
Step to the side. Thank you.
Okay. No, actually, that's great. Now I'm going to check your blood pressure. It's going to have to be a big one. Sorry.
Delete.
Do you run low for blood pressure? Okay. It's 98/64. Okay. But that's normal for you. Okay. Now I'm just going to check your scalp and your cranium. Okay. So usually since your hair is like a ponytail. No, you're fine. Now I'm just going to check the symmetry of your face, okay? And palpate. Does that hurt? No. This? No. Okay. Look up for me. Good. Look down. Perfect. Okay. Now I'm just going to palpate your temporal artery. And then open for me and close. Thank you. Okay. Now we're going to do some eye tests. Okay. So I'm just going to use this. If you could hover one eye. Okay. And I'm going to come from over this side. Can you see that coming towards you?
Yep.
Okay. This way?
Yep.
This way?
Yep.
Okay. Cover the other eye. This way?
Mm-hmm.
This way?
Yep.
This way?
Yes.
Perfect. Okay, now I'm going to just,
Oh,
I'm going to leave this light on, okay? That way we can see each other. Can you see her? Is that better? Okay, perfect. I'm just going to test your corneal light reflex. Okay, so those are working. We'll go with our flashlight. Okay, this might be a little bright, but I'm just going to flash it in the middle. Perfect. Okay. Now I need to do I'm going to do the red reflex.
there it goes.
That's working.
It's just not tight enough.
That's not, I guess. Maybe this isn't tight enough. to your eye. Okay. Now that one. Okay, perfect. Now I'm just gonna, no, it's not working.
Take the other one off, because it seems to work when you pick that one up.
Oh, okay.
So just leave that one off.
Alright, let's do it here.
It's interesting. I'll have to call. Let's go. Yeah.
Okay, so I'm just gonna come over this side. Perfect. And this side. Cool. Perfect. That's great. Okay. Now I'm going to just do your cardinal positions of beads in both your eyes. Okay. So I'm actually gonna come this way. Can you see it?
Mm-hmm.
This way?
Mm-hmm.
And up.
Mm-hmm.
Okay, now this side. This way?
Yep. Yep.
Okay, we can turn on the light now. Sorry.
Oh, geez.
Okay, so now I'm actually gonna check your ears, okay?
This is where we had it.
Does that hurt?
Nope.
And does that hurt?
Nope.
Any problems with your earlobes?
No.
I'm just gonna check the inside of your ear canal. And it still has a little wax in it.
I was in the drops last
Okay.
Tuesday. They bother me. It doesn't, that wax doesn't bother me. I've had it since I was a kid. I'm used to it.
That one looks great. Okay. Now we're gonna do the whisper test and check your hearing, okay? I'm gonna just repeat 3 words. Red, yellow, black.
Red, yellow, black.
Okay. And then over here. September, October, November.
September, October, November.
Okay. Now I'm gonna do the wetner test to see if you can feel vibration on the top of your head, okay? Can you hear it in your ears?
Mm-hmm.
Okay. Okay, let me do this again.
Yep. Yep.
Okay, perfect.
So weird.
Is it?
When you turn around, it's like.
Okay, so now I'm just gonna look at your external nose. Okay. Does that hurt?
Nope.
This?
Nope.
Okay. Now I'm just gonna look up your nose. Might be a little uncomfortable.
Oh, no.
Okay.
I know what you've been doing.
Perfect.
It's not true.
Okay.
Was there not? Is that something?
So, following.
Now I'm just going to look inside your mouth, your gums and your tongue, and then we'll do your gag reflex. Okay.
Great.
So just look in for me,
Such
and
a
then
thing.
say ah. Perfect. Okay. And do you see your dentist on a regular basis?
Mm-hmm.
Okay. Tongue depressor.
Use that. You can
Okay. This is, I don't have a tongue depressor, but I have a Q-tip, okay? So, can I think? Okay.
Oh, you actually got.
Yeah, that's good. That's good.
I do have one. I do have one.
Yay.
It's limited at best.
Okay. So now I'm just gonna check your neck to see if there's any lumps or bumps. I do see just a little bit of sunburn.
Ah.
Okay. And now we're gonna I'm gonna palpate your lymph nodes. Okay, so now I'm just gonna make sure your carotid pulse is normal. Perfect. Okay. Now I'm gonna ask you to do some range of motion with your neck. If you could just tip your head forward and then back, and then side to side. Perfect. Nothing hurts with that?
Nope.
Okay. And I just want to make sure your trachea is midline. Okay. And try to push your face against my hand this way. Okay. And this way. And also, I just need to assess your muscle strength in your shoulders, so just push up against me. Okay. Now I'm just going to palpate your thyroid, and I'm just going to have you drink a glass of water. Okay.
Mm-hmm.
Okay. So, go right ahead and take a sip. Okay, perfect.
I can feel good on this.
Okay. So, now I'm going to inspect your posterior chest. Okay. I'm just going to undo this a little bit.
She's gonna see my butt.
I just became
No.
crazy.
So I was supposed to be G-rated. I don't care, it's just Liz.
Yeah.
And all of you do.
No.
Okay. No. No. Okay. So I just want you to breathe in for me. Perfect. And again. Okay, that was just assessing your chest extension. That's great. And I'm just going to put my palms of my hands right here, and I want you to say 99 every time I press.
99. 99. 99. 99. 99.
Okay. And I'm just going to feel for any lumps or bumps on your spine. Now I'm just going to palpate anything on your spine. Okay. Okay. Now I want to just percuss the kidney area. Usually in your kidneys, I can just percuss it being dull, and just let me know if it hurts. Does that hurt?
So? No.
That? Okay. So now I'm going to listen to your lung fields on your back.
Mm-hmm.
Make sure this is warm. Okay, take a deep breath. Okay. Okay. Perfect. Are you out of breath?
I'm doing a little fast. I like that.
Okay, so now I'm going to actually have you lean forward just a little bit. I'm going to tie this up for you.
Just hurt my butt. Well, somebody else was doing the video.
Okay, just lean forward a little bit. Deep breath. Okay, your lungs are clear. Okay, so now I'm going to do your anterior chest, but just for your privacy, we can leave your gown on, okay? I will look for lumps on your clavicle, so I might just have to take that down a little bit. Okay, so I'm going to do the same thing. If you could just say 99 for me.
99. 99. 99.
heart. With you just leaning forward again. Okay, perfect. All right. So now I'm just going to assess your upper extremities. If you could just lift your arms like this for me, and then do a bicep curl, and then lift your arms all the way up. Perfect. All right.
Very graceful.
Yes. Now I'm just going to check your
I should have
nose.
flexed when I did that.
I'm just assessing the ones above your elbow. Okay. So now I'm just going to teach you the self-breast exam. I'm actually not going to do the breast exam on you. Okay. So basically when you get out of the shower, you can just stand, okay? You would just lift one above your shoulder and then just kind of palpate in a circular motion above your boob, like that. Look for any lumps or bumps. If you find any, some are normal, some are not. If you find one that's hard and not movable, then that's when you want to call your provider. Okay? All right. So, actually I'm going to have you lay down now. Let's lift this up just a little bit. There you go. Okay. I'm going to try this on. Okay. And I just need to see your neck a little bit. Okay. I'm just looking for any extra pulsations. Perfect. Okay. And now I'm just going to I'm just going to feel your impulse. Can you see me, Melissa?
I believe so.
Okay. Okay. Now I'm just going to assess for any like thrills, any abnormal arrhythmias. Okay, perfect. Okay. So now I'm just going to take your apical pulse and rhythm and assess your heart sounds and look for any murmurs.
I can't stop this, right? There's somebody at the door.
Okay, I'll check. 1 second.
Who's that?
It's okay. Okay, we're resuming.
I'll make sure I'm getting it.
Can you see it, Melissa?
Probably on the
Oh, I
Okay.
almost fell. I'm good. Yes, go
Alright.
ahead. Oh, that would have been bad.
Murmurs are sometimes hard to hear. No, you're good. Okay. Now we're actually gonna have you. I'm gonna have you lay it on your left side as much as you can. Don't worry, this is gonna be on the other side. Okay.
Can you see it like thing? You sure we should do that?
Sometimes if you have a problem with your heart, I can hear it on your left side.
I think I'm
Okay.
going.
Okay, you can. Okay. So now we're gonna inspect your abdomen. Okay.
Did that, you two?
Are you okay, Melissa?
She got a shot.
Okay.
No YouTube. That's nice.
Something your tummy is a little sunburned.
Oh, yeah, shut
Okay. Now I'm just gonna inspect it if there's any abnormal like contours in your tummy. Okay, looks good. I'm gonna assess for vowel sounds. Oh yeah, you've been eating today.
I'm surprised I have any vowel sounds.
You do. A lot of
I
them.
heard that one.
Did you hear that?
I did feel that.
Okay, good. Positive vowel sounds. Now I'm just gonna feel for any vascular sounds. Okay, so now I'm gonna just feel in your abdomen if there's any dullness. Usually in your liver, you can feel the dullness. Okay. And then I'm just gonna palpate. Does it hurt when I do that at all? No? Now I'm gonna do a deep palpation. Does that hurt? No. No. Okay. Now I'm gonna try to palpate your liver. Although your lips are protruding out. Sometimes you can't feel it. And sometimes you can feel the pancreas too. Oh yeah, I can feel yours. Does that hurt at all?
No.
Okay. Now I'm just gonna, if I was to do, I'm gonna do that, your femoral pulse. I would pull this down and do it right here, but we're not gonna do that today. I'm gonna just do your lower extremity. Okay. Okay. Can I take off your socks?
There's gonna be black fuzz all over the place.
That's okay.
Is there?
No.
I'm trying to get it.
I'm gonna have you lift up your knee.
I'm glad I can't lift it too much. This one's already got a shot.
I
Okay.
can't. Cooch.
Put it down. Okay.
My feet probably stink too.
I can smell anything.
I can.
Okay, pulses look really normal. Okay, so I'm gonna actually have you lift what is that, this leg up as much as you can.
What's good?
Okay, that's good. This one. Okay, now bend your knee for me. Okay, bend. Good. Now this one. Good. Okay, now bring this heel over your knee and slide it down your leg if you can. Okay, now this one too.
Are you getting a good shot of that?
No cooch.
Okay, good. Okay. Now, can you go like this to your feet and down and curl your toes? Perfect. Now I'm gonna have you sit up. Now we're just gonna take
Good
this
lord, I'm
down.
probably exposed already.
But I do need your thighs just so it'll go. Okay.
Oh.
Feel my cooch? Oh.
Okay. So I'm actually gonna have you close your eyes. Okay. And you tell me if it's like this is actually a Q-tip, so you're gonna tell me if it's sharp or soft. Okay.
Sharp. Soft. Sharp. Soft. Soft.
gonna place something in your hand. Okay, let me place something else in your hand.
I'm also supposed to close my eyes.
Okay. Let me place something else in your hand, and you tell me what it is.
A bracelet.
Okay, good. Okay, so now I'm gonna actually, this is testing your neurological system. You can open your eyes. We're gonna have you do like a rapid hand movement as fast as you can. So like this as fast as you can. Okay, perfect.
That's it.
Perfect. Okay, now I'm gonna assess your reflexes. Okay.
Oh god, I hate this
I
part.
know. So just bend it just a little bit. If you can't do the reflex, then you know sometimes they're absent, and that's okay. Okay. No. Okay.
My 2 fingers are weird. Am I retarded?
Thought you did the elbow.
Anna's is good.
I know it is. It's really good. Okay. I'm gonna do it on this side.
Oh.
A little.
Mm-hmm.
Okay. Now we'll do your triceps. Usually I do this one. No. Sometimes they're absent and that's okay. So I twitch it there. Okay. Now we have to do your radial pulse. I mean your radial one. Sometimes your hand will twitch. Okay. Does that hurt?
Mm-mm.
No. Let's try this one. No? A little bit.
A little bit.
Okay. Now we're gonna do your quadriceps, okay?
Oh, that's a good one.
That was a good one. And now we're gonna just do your Achilles. Sometimes your Achilles doesn't do it. Okay, perfect. Okay. Now I'm just gonna slide this up your foot to make sure you don't have the Babinski reflex. Okay, I know it tickles. Okay, perfect. You don't have it. So now I'm gonna have you stand up for me.
How much more? How much more?
Like 5 more minutes.
Alright, hurry up.
Okay. So I'm gonna have you walk towards Melissa and turn around and walk back. Okay. Now I'll turn around. And I'm gonna have you walk on your heels. Okay, stop. Turn around and walk on your tippy toes. Okay. Perfect. Now I'm gonna have you bend this knee like a squat. Kind
This
of.
one?
Yep, like that. Okay. And then the other one. Perfect. Okay. Now I'm just gonna assess your spine.
Oh god, I'm getting undressed again?
It's okay. Okay, stand up straight. Okay, bend forward as much as you can. And bend back towards me as much as you can. Okay. And now twist for me. And the other way. And try to touch your toes this way. And the other way.
Oh my god, I feel a breeze going on.
Perfect. Okay, that finishes our head to toe assessment. Thank you.
Oh my god.